Hello, this is Ryan Wernetsky,
I'm Josh Ellison.
and we're going to start this presentation on ginger as an alternative medicine project. So, what is ginger? According to Oxford Dictionary, there's two definitions. One is a hot, fragrant spice made from the rhizome of a plant, which may be chopped or powdered for cooking, preserved in syrup, or candied. It's also an actual plant, so it's a Southeast Asian plant, which resembles bamboo in appearance, from which ginger is taken. And ginger may come in root form, made into a powder, and used in teas, gummies, and food, such as pickled ginger, which is delicious.
Okay. Who would use ginger? Ginger is a natural, it's a root, so it's natural, and you'd expect people who are experiencing nausea to use it. So those with motion sickness, pregnant women, post anesthesia, cancer patients, chemotherapy patients, and people with inflammation and pain in general.
So, the effects of it that are thought to be by most people is that ginger has remedy to like pain, nausea, vomiting, especially people who are pregnant. It's like a common recommendation if you're pregnant and experiencing nausea just to take ginger. There's also research out there suggesting that it has anti-cancer capabilities as well through antioxidant abilities and as well as controlling inflammation.
Some side effects with ginger extract can inhibit blood coagulation in vitro. So high doses may increase bleeding, especially for those on anticoagulant therapy. Heartburn is another side effect, diarrhea, and large amounts may affect insulin and lower blood sugar. So diabetics should enjoy in normal quantities.
So, is this effect similar to another drug? And the answer is yes. The anti-inflammatory abilities, they mimic the effects of some analgesics such as ibuprofen, other NSAIDs, acetaminophen, COX-2 inhibitors, antidepressants, opioids, and as well as some anti-nausea medications such as ondansetron, dimenahydrinate, or metoclopramide.
So some overview and popular opinion regarding osteoarthritis. 6 studies investigated the efficiency of constituents of ginger that serve as anti-inflammatory agents. All studies reported improvement following ginger intake compared to the control group. Reportedly, ginger has been effective in a majority of studies, including those that examined alleviation of uh, NVP, which is digestive function, improvement in expression levels, markers for colorectal cancer, and anti-inflammatory functions.
So these are just another few anecdotes from a systematic review that we looked at. So there's also some popular claims to cancer prevention. So this was investigated, and it turns out that ginger does demonstrate some ability to induce apoptosis, which is cell suicide basically, in hepatocellular carcinoma, leukemia cells, and prostate cancer cells. There was also a recent study demonstrated that ginger extract suppresses progression of cell cycle in the human pancreatic cancer cell line and induces apoptotic cell death.
So we have 2 different recommendations. One, if we'd be maybe talking to a patient, and another if we were talking to a family member. So if we're talking to a patient, something a little more professional, we'd first say, well, first, if you're going to use ginger as a supplement or in a larger dose, you should consult your physician to see if any of your current medications will interact with the adverse effects, especially blood clotting and low blood sugar medications. Also, be cautious with heartburn and bloating, and for the most part, using normal amounts of ginger in your food and in your teas will be fine, taking the earlier 2 factors into consideration.
Now, a more unprofessional, not necessarily non-professional, but if you're talking to a family member and you want to make some actual recommendations, since we're not talking to them as a PT ourselves, You could probably say something along the lines of, yeah, it's probably fine to take. Just keep in mind that if you're taking blood thinner medications such as aspirin, or if you have diabetes, be careful because ginger can mess with your insulin or reduce your blood's ability to clot. Here are our references, and we thank you for listening to our presentation.
Thank you.